Welcome to Therapy Facts with Dr. Jenn. Point number 9 in how to start therapy is a tricky one because I often ask clients, and not necessarily my own, but people who I know who are in therapy, to share the fact that they are in therapy, and especially share that fact at the beginning of the process when they may be the least comfortable with sharing, because there, for every one person who goes to therapy, there are probably 10 people who would like to and 20 people who need it. So if you can be courageous enough to share your therapy experience, and again, not your details, but just your experience of deciding to go to therapy, finding a therapist, being in therapy with the people in your circle, it helps to reduce the stigma around accessing therapy. And even though there has been a greater focus on mental health wellness since COVID, especially, and a greater demand for therapy, there is still a lot of stigma and hesitation and downright fear about what it means to go to therapy. And when people say that I don't need therapists, I have Jesus, my friends, whomever, know that you're typically involved in a therapeutic relationship with those entities. And so, as I said before about therapy being both formal and informal, lots of people have experienced informal therapeutic experiences, but less people have experienced professional therapy. And so I always ask people to share the process with other people, because you never know who might listen to you, especially somebody who's not necessarily a therapist, because we licensed mental health professionals, we may be seen as pushing an agenda. Of course, most of us believe that everybody needs therapy, so we'll say we're biased, but we may come under suspicion because we're pushing an agenda. We're trying to get clients, which most of the time that's not true for most people. For most mental health professionals, they are not necessarily looking for clients. Some are, many are, but client lists, they fill up pretty quickly. But when we're out here saying, hey, think about getting professional counseling or professional therapy, it is not to push an individual agenda. It is to say, hey, we have this research-based therapeutic process that can bring a lot of individual relief and a lot of individual change that can have such an incredible impact, not for the individual, not only for the individual engaged in the therapy process, but for their family and even for their future generations that they haven't even met yet. Talking about breaking, we'll say euphemistically or colloquially, generational curses. Being able to address, say, an anxiety disorder that has run through the family and has stopped or paralyzed family members, multiple family members, from really accessing and maximizing their life. Being the first one to say, you know what, I'm going to get some professional help for this anxiety disorder that has been the gift that keeps on giving from generation to generation in my family. Being able to take that stance and say, hey, I'm going to be the first one to do it, can chop out a pathway, can hack out a pathway for other family members, and can change the direction of multiple generations of your family. And again, family members that haven't even been born yet. So that is true for the individual and their whole village, their whole family. But that's also true for friends and even people that you don't know. That if you're able to share and say, hey, I decided to go to therapy for this, and this is how I gained access to a therapist, and this is how it's going for me. can be the biggest public service contribution you can make of your entire life.